You're listening to Menopause Natural Solutions, episode 91, Adenomyosis. Welcome to Menopause Natural Solutions, your podcast for all things perimenopause, menopause and beyond. Stay tuned as your host, naturopath Jennifer Harrington, explains how to use natural therapies to find your ultimate health and happiness during your transition. Hi ladies, it's Jen here. Today I'm talking about quite a serious condition called adenomyosis. This condition affects about 1 in 5 women. One of the biggest risk factors is being a female over the age of 40. Other risk factors include having more than 2 pregnancies or a history of uterine surgery. With my podcast demographics, that is most of us, including me, today. So what is adenomyosis? It is a benign uterine condition where the uterine lining is found infiltrating into the muscle wall of the uterus. On physical examination, it feels quite enlarged and bulky. With a bulky uterus comes a larger surface area within the uterus, and this brings longer, heavier, more painful, clotty periods. Some poor women may experience up to 2 weeks of heavy bleeding with large ball-sized clots, plus additional spotting throughout the cycle. You can imagine this isn't fun. The associated anemia from the heavy bleedings and the inability to perform usual daily tasks would be reduced. And the depression and fatigue can also be factors. And unfortunately, penetrative sexual activity can be extremely painful, adding to the frustrations of this condition. Many describe the pain as being a burning pain. I often compare it to an internal fire, as this condition is so inflammatory. We know that certain factors act as fuel for the flames, but we also want to consider if we can find a spark that started the fire in the first place. Fuel sources for the continued development of adenomyosis include estrogen dominance and insulin-like growth factors. Many women in perimenopause aren't regularly ovulating, and this reduces the amount of progesterone in their system. Progesterone helps keep estrogen in check. Without it, you may benefit from estrogen regulating strategies. And some examples include the use of sulforaphane from broccoli, or calcium diglucarate, or even DIM. But there are also conventional drugs that suppress estrogen, and Zoladex is an example, but these drugs come with side effects like depression and bone loss. Another option is progesterone therapy, just adding in that progesterone that you're not getting each month. And that can be in the form of a Mirena IUD or as an oral medication. The other common fuel source is insulin-like growth factors, which occur due to imbalanced blood sugar levels and insulin resistance. Dietary changes to reduce sugar and intermittent fasting to reset insulin levels is recommended. The spark that started the fire in the first place varies from woman to woman, and it's not always identifiable. But when it is a priority to correct. The most common spark I see is immune dysregulation and infection, with ureaplasma being one of the infectious troublemakers. If you have adenomyosis, it's worth having a vaginal microbiome test or a menstrual blood test to investigate for infections. It is common to have additional diagnoses alongside adenomyosis. Some women also have endometriosis, which is a similar but a different condition. This time the uterine lining has grown in other places, such as the fallopian tubes and around the ovaries. It's also linked with irritable bowel syndrome, and interstitial cystitis can also be found. It's usually diagnosed with an MRI. It may be seen on ultrasound, but this technology isn't as advanced and you may be misdiagnosed as having fibroids. A gold standard for treatment is a hysterectomy, and if your quality of life is that bad, it might be worth having. But there are also less invasive procedures like endometrial ablation or getting a Mirena IUD fitted that could also be helpful. Medication-wise, we've discussed a few options, but just to summarize your options, they include hormone suppression, progesterone treatment, antihistamines may help reduce blood flow and pain, as can antifibrolytic medication like tranexamic acid. If infections are found, antibiotics are probably warranted. As a naturopath, I'm looking at the whole woman. How can I help her rebuild her blood supplies, address any infections, boost her energy levels, improve her mood, reduce her inflammation and pain, reduce insulin issues, regulate her hormone, improve her cycle by reducing her clotting menstrual flow? Or if she chooses to go ahead with surgery, I can help prepare her so that she can get the most bang out of her buck and have the fastest healing and recovery possible. Before we end, I just want to mention a couple of lifestyle considerations. Due to infections, public swimming pools and spas are off limits, but natural waters like the beach are generally okay. If you test and find an infection, please also test your partner, because it may be necessary to also treat your partner to prevent re-exposure to the infection. My final thought is in regard to xenoestrogens or environmental compounds that have an estrogen-like effect in the body. You may like to go back and listen to episode 61 on environmental health for more details on how to avoid these dangerous substances. Well, guys, that's it for me today. I hope you are all well. If you have been considering taking me up on one of my lockdown promotions, there were 4 of them in total, and they all end this Friday. So you may want to pop over to my website and just have another look, because if you have been considering working with me, now is the best time. I hope you're all well. I look forward to seeing you again next week. Bye for now. Listening to Menopause Natural Solutions. This podcast contains general information about menopause. It is provided as a guide and is not intended to replace medical advice. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. If you have enjoyed today's episode, please leave us a 5-star review.